Well, when you think of things that couples share, sense of humor, common interests, or even practical things like a bank account come to mind, but you probably didn't think of high blood pressure.
That is the finding of a new study. When one partner has high blood pressure, there's a good chance the other person does too. Dr. Frank McGeorge, I guess knowing this is a helpful thing, right?
Yeah, it definitely is. You know, Karen and Devin, when we see patients, we usually see them as an individual, not as a couple with their spouse. And based on this study, that means we are wasting two opportunities. First, a chance to find high blood pressure in their spouse, and second, a way to manage a person's blood pressure as a couple, not an individual.
In the paper published in the Journal of the American Heart Association, nearly 34,000 heterosexual couples in the United States, the UK, China, and India provided information on their blood pressure and other health characteristics, allowing researchers to see how common it was for high blood pressure to exist in both partners. In the United States, both partners in a couple had high blood pressure 38% of the time. In fact, if one person in a couple was found to have high blood pressure, the other was between 6 and 9% more likely to also have high blood pressure. I spoke to Dr. Jitin Sam Varghese, who was one of the lead authors of the study.
When you're a married couple, you are more likely to share certain lifestyle behaviors together. You may have certain dietary patterns that you follow or certain activity patterns that you follow. You may be more likely to sleep for around the same amount of time. And all these may contribute to a similar burden of hypertension in both pairs of the couple.
His biggest takeaways:
if your spouse has hypertension, it is worthwhile to get yourself screened for high blood pressure regularly. And moreover, considering joint management strategies and holding each other accountable are practical and very easy to implement. Some ways to do this are to pursue healthy eating together, or working out together, or holding each other accountable for taking medication, or even visiting your primary care provider together.
Now, this really shows how important it is to think about the lifestyle factors that could be contributing to your hypertension, especially if your spouse also has high blood pressure. Big picture, you should know your blood pressure, and your partners should know theirs too.
And remind us again what numbers people should be, because a few years ago they changed.
Yeah.
What numbers people should be looking for when it comes to high blood pressure?
So starting with normal is basically 120 over 80 or less. Anything above 120 is considered high, but there are steps actually between 120 and 130, for example. That's considered elevated, but we consider that kind of a warning range, a warning track, because if it's that high, it usually progresses from there. When a person's blood pressure is consistently over 130, that is when we consider it hypertension and worthy of treatment of some sort. When it's 130, it's probably going to be lifestyle, exercise, diet, that kind of thing. When it gets higher, then we're talking about medication.
But we report on this all the time. It's such a pervasive issue that's so easily treatable, right?
Completely
as long as people know.
That's the key thing. People need to know what their blood pressure is to know that they need that kind of attention.
Not enough people get it checked.